Ever since I was a kid, I haven't been able to sleep well. I tended to be a little bit anxious, had some panic attacks, things like that. My trapezius muscles back here would always be tight. My neck is always out. I had hypermobility syndrome, which is a connective tissue disorder, and type A. So, okay, I didn't think about any of that as anything except that that's just the way I was. So, come to find, so I've been doing sleep studies in my 30s, 40s, and 50s. And most of the time they showed either mild sleep apnea or no sleep apnea, but borderline. And then my last one, when I was 58, maybe 59, showed moderate sleep apnea where I was not breathing 20 times an hour at night, not breathing, not just waking up, not breathing. So it's like, oh my gosh. So I'm like, okay, I've got to do something about this. So anyway, a couple years ago, after one of my sleep studies, many years ago, I tried CPAP twice. Couldn't tolerate it. It dried me out, all kinds of stuff. So I couldn't tolerate the CPAP. So that was in my probably 30s, and then maybe again in my 40s. And then in my 50s, early 50s, I had another sleep study, went to an orthodontist and said, just straighten out my teeth enough so that I can get an appliance a dental appliance to pull my jaw forward. Because I had a over on the top and under on the bottom. So just to pull my jaw forward, because I could tell if I pull my jaw forward, I could get a full breath. I could get diaphragmatic breathing. I can go into relaxation mode, which I can't do normally. So dental appliance didn't really work. It was too much pressure on my teeth. It worked for maybe the first night, but then subsequent nights it didn't work. I did another sleep study last year and then went to another dentist about what other options were there. And he said, looked at my appliance. He's like, I'm not gonna be able to get anything smaller than that. And your mouth is the size of a child. It's a child-sized palate. That left me nowhere last fall. So I had found a book last year, or maybe the year before, called Jaws, The Hidden Epidemic. So I recommend that you get that. I've linked that below. That kind of opened my eyes to the fact that some of what I was experiencing was, bigger than just me. And I have two grandkids now, and I thought, oh, my daughter needs to know this stuff because it's stuff that she can do with her kids when they're young so they don't fall into some of what I'm experiencing. And then come to find out in March of this year, 2024, my daughter, who's 31, said, I'm experiencing a lot of clenching and grinding and different things. And I'm like, oh my gosh, well, she went through 6 years of orthodontia. I hadn't had orthodontia. So she said she had a palate expander. I don't remember that, but she said she had a palate expander. She had 14 teeth pulled, 8 of them permanent. So she's experiencing problems even after 6 years of orthodontia. Okay, well, when I was reading this book, Jaws, The Hidden Epidemic, it explained some of why that might be the case. Then she found something about tongue ties. Now, her second child was born last December, and he had a tongue tie release and a lip tie release with the laser. And I'm starting to research like tongue ties, and she was researching tongue ties. Come to find out, I have a tongue tie. Sorry, this expander it's hard to talk. She has a tongue tie and a lip tie, my 31-year-old. And when she was a baby, she slept 8 hours a day. 8 hours a day. I'm talking about day and night total. And so I was at basket case and she would cry a lot. And I would take video of her and take it to the doctor and be like, pediatrician, and say, what's going on? And they're like, oh, it's normal colic, which means air in the stomach or gas in the stomach. Give her these colic drops. And I'm like, well, maybe it's something I'm eating. I went on an elimination diet and nothing helped. In the meantime, I'm like suffering as well. And it turns out what I believe, and she and I are both like upset, angry, in tears. When we determined this past March, was that her tongue tie and her lip tie was causing her not to nurse well. And nowhere along the line had anyone mentioned anything. We had a lactation consultant come in when she was first born. They didn't mention anything. The pediatrician didn't mention anything. No one said, hey, get this checked. Maybe she's getting air. Check with another lactation consultant. Maybe she's got a lip tie, tongue tie. No one said anything. That's when I went on the elimination diet. What could I do? What was happening? What could I do to help this? Nothing. And had someone said, she's got a lip tie, let's release her lip tie, get a better latch and she won't be getting that much air. It would have resolved things tremendously then. but not too much then, not just then, now. So I don't know what people understand, even new moms that choose not to do a tongue tie or lip tie release, is they potentially could find that their child has issues down the road that, not just speech and stuff, because both my daughter and I have perfect speech except right now because I have this expander in, but anxiety, muscles tension. I mean, a number of different things that you can look up about lip ties or tongue ties. Tongue ties specifically is what I'm looking at because that's what I have. So anyway, my daughter is in the boat where she's got the long tongue tie, lip tie. She's grinding. She's her palate, different stuff, right? But right now, let's just focus on me because she's kind of waiting to see my journey before she does anything. Um, so I have a palate the size of a child, and so it never expanded. Again, read the book Jaws, The Hidden Epidemic. It will help you understand some of this. So lots of sleep studies over the year, probably like 5. Twice on CPAP, tried a dental appliance, and so this coming up with all this tongue tie stuff and the palate and stuff, I'm like, you know what? I'm going to go and interview an ENT, a surgeon, an orthodontist, a functional dentist. Because if people just stay in their own lane, they aren't looking at the whole picture. I'm like, I need to get a view of the whole picture before I decide what I'm going to do. So let me go to a functional dentist. Okay, what are you seeing? What do you recommend? Let me go to an ENT, and specifically an airway ENT and an airway surgeon and an airway orthodontist because I know I have airway issues. So I got a CBCT scan done at the functional dentist office because my dentist didn't do them. And I needed that because when I set up my virtual consult with the ENT, Dr. Zaghi out in LA, I needed to have a CBCT scan sent to him. So that is a cone beam CT scan of kind of my mouth head kind of thing. So I got that done and sent that over to him. And he said, yes, you have the palate of a child. And here's what I would recommend. And that's where he said I would get a Marpe, which is the mini screw assisted rapid palate expander to expand your palate, and then orthodontia, and then potentially a tongue tie release. And you might even need then lower jaw surgery um, after that. So, and then with the tongue tie release, there's myofunctional therapy. You might do craniosacral therapy in amongst all this. Okay. So my first step was Marpe. But before I did that, I said, let me interview a surgeon. So the Breathe Institute, which is where Dr. Zaghi is, also has the surgeon there. So I consulted with him as well. And he said the same thing. Now he does Marpe, right? This mini screw assisted rapid palate expander, but he does it with some minimal cuts. So his is called Mind, minimally invasive. And I don't know what the MD stands for, but the orthodontist periodontist that I went with doesn't do any cuts. So there's no surgical, there's no cuts, there's nothing invasive. But there's pros and cons for both. Anyway, so I talked to him and he said, if you're not going to do with the cuts, I agree with Dr. Zaghi and I agree with the person that you're looking at because she's the best on the East Coast. Okay. So got confirmation there, got a report from him. I always want to recommend that if you do consults, just ask them ahead of time. I want a written report afterwards. And the reason is possible you can get some things paid for by your medical insurance. I haven't tried it yet. I did not. I got one report. I didn't get one from Dr. Zaghi. I'm going to go back now and ask if I can get one from him and get one from another orthodontist that I interviewed. Anyway, I'm hoping that some of my paper trail could potentially, even though this is going through dental, I'm hoping that somehow my medical insurance will pay for some of this because it's not cheap. Okay, so I did I did the functional dentist, the ENT, the surgeon, and then I interviewed an orthodontist here in my state, closer, right, about 40 minutes, 45 minutes away. And so, I liked her, but when I interviewed the orthodontist I went with, who is 3 hours away from me, because I have hypermobility syndrome, she was a little more I don't want to say adamant, but just suggested that she has done so many of these, and she is very aware of the hypermobility syndrome. And because I'd be doing my Marpe and my orthodontia with her, she felt like she couldn't recommend anyone else. She really recommended herself, and I didn't think that was like a pride thing. I just felt like based on her experience, because she's done so many. So that's where I am. I got my measurements taken in August. 6 weeks later, I got the appliance, this Marpe appliance. So she uses a CBCT scan. So it's a personalized, appliance for you when you get it done. It's designed for you using your CBCT scan and the measurements, your age. She put 6 screws in mine because I just turned 60 and I'm 3 hours away. Sometimes she does 4. There's just, it's all tailored to you. So that's where I am. I got the appliance on last Wednesday, October 9th, and my next video will talk about that. But I wanted to give you a background of where I've come from to where I am. So I hope that's been helpful. And I will link below the people that I consulted with, and because a lot of them were virtual, so anybody can do them, depending, no matter where you are in the world or in the country. And a couple of other things I'll just link in the description. So anyway, hope that was helpful, and I'll see you on the next video.